Tommy John has plagued the sport of baseball for many years. It has also ended the careers of some of the greatest pitchers we have seen, but it has also helped and saved the careers of many pitchers. Some pitchers, for example, are Adam Wainwright, Jose Fernandez, or Steven Strasburg. What Tommy John is the tear of the UCL ligament in the elbow. And as Tommy John is also the surgery that has to happen to reconstruct that elbow. In this speech, I will discuss Tommy John, the person, Tommy John, the injury, and Tommy John, the surgery, as also the rehab and recovery that happens after. Having Tommy John is the most feared thing in all of baseball. To begin with, I'll talk about the man who started it all, Tommy John. Tommy John was born on May 22nd, 1943 in Terre Haute, Indiana. In the game against the Montreal Expos, Tommy John delivered a pitch that went straight to the backstop, and he felt like something was wrong. He felt like his complete left arm was not connected to his body. After he finished the pitch, all he felt was a deadness in his elbow and arm. Just complete nothing. So after another pitch, the same feeling occurred, and again the same pitch went to the backstop, the feeling of nothing. As resilient as Tommy John is, this might end his career. A month later, after trying to recover, the same thing happened in another game. He threw a pitch, went straight to the backstop, and again the feeling of nothing. So a day later, Tommy John called Dr. Frank Jobe, a surgeon that he has worked with before. Then, on September 25th, 1974, Dr. Jobe went to work for 3 hours, and the result was a groundbreaking surgery that would save the arms of many pitchers in the future. But not just pitchers, this surgery can also help tennis players, racquetball players, and volleyball players. Next, I will talk about the injury that takes place. The injury that has to happen, this injury is what has to happen for the surgery to be necessary. This injury, of course, takes place in the ulnar collateral ligament. This injury takes place when repeated motion or repeated stress is used on the elbow, and then results in the tear of the UCL. Some symptoms for the tear are tightness on the inside of the elbow, numbness, and of course pain when using your arm. Lastly, I will discuss the surgery, as well as the recovery and rehab that follows. To begin, the surgeon outlines the UCL. Then the surgeon takes the palmaris longus tendon out of the forearm, a tendon out of the hamstring, or cadaver, which is an artificial tendon, to be used. Then the surgeon cuts the ligament of the elbow and separates it. Then 4 bone tunnels are created, 2 in the humerus and 2 in the ulna. These tendons are created so the tendon that was harvested can be used and fed through to repair the elbow. Braces are then needed to reduce mobility, like this brace here. And then some things for pitchers for rehab are very precise. No lifting for about 4 months, no overhead lifting, of course, and a certain schedule for throwing to get back to that full motion. So being healed and being fully able to compete takes about a year of recovery. In conclusion, Tommy John is a painful injury that can happen to anyone. Every pitcher needs to take precaution by not throwing and do extra stretches to make sure the elbow is fully warm. Tommy John surgery has a high success rate, but preventing it in the first place can solve a lot more. Preventing it can start with having kids not throw curveballs until their elbow is fully developed, and of course not overthrowing like many kids do. My second visual aid is my stepbrother Pat, who has had the surgery. As you see on his elbow, you can see the scar that is left from the surgeon cutting into the UCL, and also you can see a ligament that can be used for the surgery. Now what he does for this is every week he rotates it 10 degrees to get his elbow back to the way it is. Thank you.